On any given day, the population of Oahu can be nearly 1.5 million people. Residents, visitors, and our military community. Last year, Oahu's emergency medical services responded to 86,000 calls for help. Officials say that number will continue to rise. Can an aging fleet of about 24 ambulance units cover the population the size of Oahu's? Is it too big an ask of EMS? This live broadcast and live stream of Insights on PBS Hawai'i start now.
Aloha and welcome to Insights on PBS Hawai'i. I'm Yanji Denise. Honolulu's paramedics are on call 24 hours a day, 7 days a week, and are available to anyone on Oahu and throughout the state needing medical services, from residents to tourists to the homeless. Last year, the Honolulu City and County Emergency Medical Services Department, or EMS, received approximately 86,000 emergency calls. So far this year, it has received 5,100 more calls than at the same time last year. Can EMS, which hasn't significantly expanded its resources since acquiring a 20th ambulance unit 5 years ago, keep up with the increasing demand for its services? Tonight's guest panel includes 3 members of our community who are on the front lines of emergency medical care and a state representative whose committee considered EMS legislation during the last session. We look forward to your participation in tonight's show. You can email, call, or tweet us your questions, and you'll find a live stream of this program at pbshawaii.org and on our PBS Hawai'i Facebook page. Now to our guest. Dean Nakano is the Chief of Emergency Medical Services for the City and County of Honolulu. He became a mobile intensive care technician, also known as a paramedic, in 1981. He was promoted to Chief of EMS in October of 2015. Tony Altamari is a paramedic supervisor for the Kailua Unit of Emergency Medical Services. He's been with EMS for 20 years and received the Silver Medal of Valor for helping to rescue a man who was engulfed by fire. Dr. Ronald Kuroda is an emergency medicine doctor in Honolulu affiliated with the Queens Medical Center. He was the recipient of the John A. Burns School of Medicine Clinical Faculty Teaching Award in Emergency Medicine. And Della Albalati is the newly appointed Vice Speaker of the State House of Representatives. She chaired the House Committee on Health this last legislative session, which considered legislation dealing with EMS. We want to dive right into this. Thank you all for being here tonight. And Chief, we want to start with you. Give us a lay of the land. 20 rigs to cover an entire island. That is quite a task. It is. And actually, 18 of them are full-time. 2 of them are only on 12 hours. So it's pretty difficult. How are they able to do all of it? Well, we have a bunch of dedicated employees who work hard every day. This is a job that you have to want to do it. You can't just say, oh, I want to do this job and expect to go to work every day and be able to, save people's lives. I mean, I think when people hear that number, 18 full-time, 2 part-time to cover all of those people, is that actually possible? When you do the math, it doesn't seem like it is. It doesn't, but we do it. We even manage sometimes with less resources if an ambulance breaks down or but we do it every day. Speaking of doing it every day, Tony, let's talk to you. You're on the front lines of this. How are you able to manage that kind of a call volume given how few resources you have?
Oh, it's tough. It's tough. Super busy. Like sometimes you don't even have time to go to the bathroom. It's very challenging. But like Chief Nakano said, you do it because you want to do it. So you're not going to turn the call down when it comes in. You're going to go. I mean, we're so busy now. Like sometimes you're on a call and you still got a patient with you. And you get to the emergency room and they're already calling you for the next call. And wow. That's how we're going to these calls, is they're just stacking. They're stacking and it's stacking. The workload must be incredible and the burnout must be incredible too. It's tough, yeah, and burnout is a big issue, yeah. And a lot of our employees deal with it every day. Yeah. And on the other side, on the receiving end, doctor, that's you. You're seeing these guys work so hard. When you're dealing with just 20 rigs to handle the whole island, well, how does that impact the hospital?
Well, these guys do a great job. They bring in about 25% of the patients that come to the emergency departments, and they do a terrific job as far as bringing the sickest. almost half of the patients that they bring in are sick enough to be hospitalized. So it's not like the run-of-the-mill thing. So I give them a lot of credit for how they're able to get the people from the scene and safely bring them to us so that we can provide the hospital side of care.
Della, I think people want to get in on the funding here and sort of understand how that works, because we are talking city and county, but this is state funding.
So what we have to understand is that EMS is a statewide service, and so the state coordinates all the counties. Each year, or at least this year, the state appropriated all methods of funding over $87 million. So this is general funds, and it is funds coming in from the cigarette tax as well as the annual motor vehicle registration fees.
So in layman's terms, you guys ran out of cash.
$85 million is a lot of money, and it has to go to all the counties. So, you know, when you talk about the last time city and county had a new ambulance, that was also the last time that Maui got a new ambulance, and no other county has had a new ambulance since then. So we are struggling with the ask that come in every year.
Chief, I mean, what does that mean to not have, you know, to ask year after year and not get that granted? What kind of a strain does that put on your system?
It's frustrating, because when I first started 37 years ago, we had 13 ambulances. And so in 37 years, we've gained 7.
Wow.
Yes.
Our population has grown immensely.
Right. Back then, when the population was about 750,000, now it's over 1 million, not counting tourists. And back then, I don't know if our population is aging right now, and we have a lot more calls now. But back then, you know, we managed with that many because we didn't have the call volume that we have today.
What difference would another rig mean?
We actually would need 5 more rigs right now. You know, just to give these guys a break, because I hear it on the radio every day that these guys are running nonstop, and there's very little that we can do. When we have extra staff, we put extra units on the road to help them out, but that doesn't happen very often.
I mean, it sounds almost like a game of, you know, plugging the dike, just whack-a-mole, right? Like here and there. And so when you talk about all these rigs being assigned to all of these different areas, some places do get uncovered. Tell us about that.
Well, we have 5 ambulances dedicated to the Honolulu area. And on every day, we have to pull ambulances from Kailua, Kaneohe, Wailupi, Hawaii Kai, Aiea into run calls in town. Then the other outlying units have to cover more areas. Like, you know, Nanakuli would have to cover into Waipahu, Waipahu would have to cover into Aiea. And then the 3 units on the windward side would have to cover each other.
When we're talking about big swaths of land, those aren't quick trips. How are they able to do it?
Well, we have a core response agreement with HFD. So they have more stations than us and more personnel, so they're able to cover when we're not able to cover. And we also have a backup contract with the AMR, the private ambulance service.
Yeah, I want to get to that because I think there is this perception that there are these private companies that will sort of fill in the gaps, but what they're doing doesn't match the level of what you're doing.
There's only one private company on this island, AMR, and they do basically inter-facility transfers, but they are our primary backup, and they do help us a lot.
Tony, talk about being, you know, you're running the windward side, but sometimes because of all those calls to town, windward is left basically uncovered. How does that work on a day-to-day basis?
Well, Kailua's only got 1 ambulance. Kaneohe's got 1 ambulance. Waimanalo's got 1 ambulance. So the metropolitan units are so busy that sometimes they get overwhelmed, and so then the other units have to cover. So a lot of times the Wailupi unit, the Hawaii Kai unit will come into town, and then if they're all in town already running calls, and you call 911, they got to send somebody, and so the next outlying unit may be Kailua, and so you know I've been there since January, and we come into town pretty much every shift.
Every shift?
Every shift, yeah. And when we come into town, it's not only to run one call. Usually we're coming into town, we're running 2, 3 calls. So you'll see me in Waikiki on the beach sometimes because there's no units to cover.
What does that mean if you're in Waikiki and someone has an incident in Kailua?
Well, if the Waimanalo unit's in or the Kaneohe unit's in, depending on who's closer, they'd have to cover. So sometimes dispatch will kind of move a unit over so that they can cover a bigger area. But once those units go out, so if there more than 3 people call 911 on the windward side, then the next unit is either Kahuku or a town unit.
Wow.
So you got to wait for somebody to come over the mountain. Yeah.
Doctor, when people are coming to you, obviously time is of the essence. When there is that kind of a situation, how does that affect the care that you can give?
That's a great question because the time frame for some of these medical conditions, sepsis, bad infections, heart attacks or strokes, we now with science have these treatments that can really make a difference, but there are windows of when you can give these drugs or medications. From the time that the patient starts having their symptoms, you want to be able to help a stroke patient within 3 hours, or somebody who's got a really bad infection within 3 hours, and it shows that their outcomes, their survival actually improves. So being able to have quick responses is important, and everybody knows about the car accidents and the traumas. And for those, if somebody's bleeding out, these guys getting to the scene quickly does make a difference.
You know, you hear all of this. Clearly, there's an immense need. Why has it taken so long, and when can they expect to get those 5?
Well, again, I have to say that this is a shared responsibility between the state and the county. And urban legislators are very concerned about the lack of or the need for more ambulance units, EMS units within the urban core as well as in the rural areas. We've looked at and tried to find creative ways to finance. You know, one proposal that we looked at this year was whether or not parts of the TAT could help fund the operations and maintenance of a unit. And we're exploring these ideas, but we need to get the commitment of the city and county. You know, when we hear that there's calls in Waikiki, or we hear from the mayor that, you know, so much of the services being utilized are being utilized by the tourist. Well, so can you show us how the TAT can be used to accomplish some of these? Again, it's a shared responsibility, and we have to make sure that the pot is available for all the counties.
The calls are already coming in very quickly. The mayor is pushing ahead with a giant new firehouse in rural Hauula, which the community thinks is too big and costly. What can we do to get our vital EMS unit restored to Ka'ava instead? Casey Connors asking this one tonight. Chief, who is deciding sort of what comes first? If this is state resources, but it ultimately does come down to the mayor.
No, not really. It becomes the State Department of Health's responsibility to decide where the next unit is going to go. And they go by statistics, number of calls, the population in that area.
Where do you see the greatest need?
Right now, it's Honolulu, it's Kaka'ako, it's Salt Lake. It's all in the area where there's so much growth. And next would be in Kapolei.
You know, I think there's this perception, and Tony, you can probably speak to this, that because our homeless population is in this crisis, that they are overburdening the system with perhaps non-emergency calls in some cases, or people who call again and again and again. What is the impact of the homeless population on EMS?
It's huge, but are they overburdening us? You know, I think the whole system, I mean, there's a lot of people who are sick that need help, and there's a lot of homeless people that are sick that need help. So, you know, I mean, they do burden the system, and the more people there are, it's going to burden the system more. I'm not sure if we can say it's just the homeless themselves, but when the homeless people need help, they call 911. I mean, that's the only place they know how to get help, and so then we have to go. I mean, that's just kind of how it goes. And but yeah, I don't know. Any comment on that? I mean,
So there were proposals at this legislative session to do mobile clinics, which would be putting nurses and doctors out there. The conversation continued around that, but I think what we really need to look at more is community paramedicine. And I know that there might be some fruitful projects moving forward here on Oahu, but on the Big Island, the paramedics there are engaged in community paramedicine, and that's going to help alleviate some of the calls. Maybe not the homeless, but those individuals who might be aging in place, and they also are heavy users of the 911 system. So there's a lot of other things that we can look at that's happening on the neighbor islands, as well as other jurisdictions where they're experimenting with community paramedicine. But again, that takes time.
What would that actually look like?
In other jurisdictions, we know that some of the paramedics are, they see things out there in the field that may actually be contributing to a person's health in their environment. It's that classic, like seeing the carpet that's loose, and that's what might have caused the fall. It's seeing those kinds of things that are not necessarily medical related, but lead to medical treatments, and that they can spot that and then help with that. We also know there are community paramedicine pilot programs out there that are helping people deal with chronic illness, so diabetes treatment and follow-up. All of these initiatives are in many ways coming out of the Affordable Care Act, which is pushing people to have, and the system to have a better network of care so that people don't keep coming back to the hospital. That's a system, though, that we're building, and it's going to take time to build.
This question kind of piggybacks on that idea. If more civil servants were trained in first aid, could this alleviate the shortage problem? For example, if lifeguards were increased, would there be less need for ambulances? Chief, what's your thought on that?
We still would have to take them to the hospital. You still need those ambulances to transport them to the hospital. So they could get help faster if there were more people trained, but we still would have to get there and, treat them.
How much money are we talking about? What does an ambulance actually cost? If we factor in also, of course, the paramedics who would have to be on there with it.
Right now, a brand new ambulance costs about $200,000. Just the ambulance. Then you're talking about adding a specialized gurney, which is another $50,000. Then is the radios, the computers, the equipment, and the two personnel. You're talking over $300,000.
Tony talked about just how hard it is day in, day out, sometimes not even having the time to go to the bathroom. What about retention? How are you doing with that?
Since we went to the 12-hour pilot program for our employees, our retention has gotten a lot better. But you have guys like me who have over 30 years, and we have like about 25 to 30 of people who have over 30 years of service. And, it's questionable how long they're gonna last. So filling in, we gain 5, we lose 5. We've been doing that for a while.
You're a supervisor. Obviously, you talk to some of the guys who are coming up through this system. What are you hearing from them about staying in this career?
It's hard because they're overworked. I mean, there's a lot of burnout. I mean, when you go to work and you know that you're going to run 15, 16, 20 calls in a 12-hour shift, the next day you're beat up, and so you ask people if they want to do that for the next 15, 20 years, and most people tell you no, because it's a tough job, They love to do it, but a lot of them aren't sure if they can physically do it and mentally do it for the next 15 or 20 years. Yeah.
I mean, if 5 more rigs, for example, were added to the system and you had that kind of relaxation of that kind of pressure,
absolutely
what difference would that make?
Absolutely would help, because your call volume would go down. You'd have time in between calls to kind of refocus and reevaluate and get ready for the next call. Whereas right now you're just going stack to stack to stack. The calls are getting stacked on you. And so sometimes, if you look at the stack on the queue, we might be five calls down. And so you're trying hard to turn your patients around so that you can go out and get the next one. So doing that day in and day out, it wears on you and wears on you, yeah.
I mean,
the
Doctor,
burnout is big.
If you're number 5 on his list, that's a scary place to be.
That would be a scary place to be. The burnout factor is a big thing for these folks because the type of patients that they have to bring in, it's stressful. Going back to the community paramedicine program, I think it would be a great help, but in some of our data, when we're looking at it, patients that are homeless or what we call people who come in more than 3 times in a 3-month period, that only makes up about 25% of the patients. So 75% of the people that EMS transports into the hospital actually are first-time users, maybe second-time users of their system. So it would address a problem, but there's a lot of other issues to take care of.
This is something that would affect all of us. Due to our limited emergency vehicles, is Oahu prepared for a catastrophic event for mass casualties? Joe and Iea calling in with that one tonight. Chief, are we ready?
That's a good question. I mean, our personnel are prepared as far as the resources. We would handle as best we could.
So walk us through that. Let's say there is a tsunami, a massive earthquake, a terrorist incident, who knows what, something catastrophic happens. You know, EMS comes, those 20 rigs get in gear, AMR sends however many units perhaps they have, then...
Well, we have also mutual aid with the Fed Fire and the military. So in case of a natural disaster or terrorism, yeah, we have mutual aid, so we can use them also.
So in that sense, we do have some stopgaps there.
Right.
What about just, you know, a major traffic pileup? I mean, something that doesn't necessarily, you know, alert the military.
Oh, we can handle that. We've been able to handle everything that's come our way. And just to clarify one thing about calls waiting in the queue, what we have is a priority dispatching system. So if you're number 5 on the list, but you're considered severe, you move to the top of the list.
Okay.
You're not going to be waiting
Right.
on the bottom of this if you're severe.
Right. I mean, I'm sure there are practical plans in place. And you did mention HFD. I think that people get a little confused because they see fire activated, and that's because there simply are more fire stations.
Correct.
In terms of resources, how many more are we talking about?
They have, I believe, 50 fire stations.
Wow. So you're really outmanned there.
Yes, they have over 1,000 employees, and we have 250.
You know, Doctor, when you hear about that disparity, does that make sense?
The EMS folks, they're really highly trained. The type of training that they go through the EMT program at KCC to begin with, and then they get road experience, which is irreplaceable, to see if they would qualify to become a paramedic or an MICT. I can't say that we could really train that many people to have that high level of insight and experience out there. Unfortunately, not everybody is cut out to do the stressful work that these folks do and the things that they see. They, you know, package the patients up so well. By the time they come to me in the emergency department, even if they were bloody or bleeding, when my trauma team can see them, we can get to work because of all of the work that they've done outside of the hospital.
You know, Tony, I wonder, I mean, we all worry about a terrorist attack or a mass casualty event, but what keeps you up at night on this? I would think that it would be, you know, too many heart attacks on one side of the island, or, you know, I wouldn't think that it would necessarily be terrorism or something like that.
What keeps me up at night? I don't want to disappoint my patients, you know? I want to make sure I do the best that I can for them. As far as terrorist attacks and things, we train for that kind of stuff. So the training kicks in. So I know how to do that kind of stuff. But actually, you know, dealing with family members and patients and kids, and you know, I don't want to let them down. That's what keeps me up. Yeah.
You know, I wonder, the state, of course, has done drills for mass casualties. Do you feel like, given how many rigs we have, we are prepared?
Well, I've seen some of the practices they do, and it's quite amazing, the teamwork that actually occurs at the federal, state, and city level. I think we could handle that. I guess to turn the question a little bit, I do worry about the day-to-day, you know, experiences of folks, and we need highly trained people out there, but it's always going to come down to the challenge of money and resources.
And this question is about money and resources. It's directed at the chief. Linnell wants to know, what percentage of calls does AMR respond to on Oahu? Do a lot of EMS workers also work for AMR? And how much money has the city paid to AMR last year? I don't think that not necessarily everybody knows that when an AMR call happens, that actually takes money out of EMS.
Correct. I can't give you the exact number that they respond to, but it's it's been going up because of our call volume, and when we actually run on the rigs, we have to use them as a backup service. So we do have to pay them, and quite a few of our people do work part-time for AMR.
When we talked about this a little bit before, but I want to go back to it. People who are seeking a career in this, you've done this for a long time. Obviously, you found it very rewarding. Tell us about the kind of person you're looking for and the opportunities that are there. I mean, hopefully this is not all doom and gloom, and we can inspire some folks to join the ranks and, you know, perhaps alleviate some of the stresses that we're talking about tonight. Well,
It's a job that you gotta have to want to do. It's not, oh, I think I can learn to do this job. It's about helping people when they're at their worst, when they're real sick, when they're almost dying. And it's not only dealing with the patients, you're dealing with the public, you're dealing with the families. You know, you have to be compassionate. And like Dr. Kuroda said, you have to be smart to do this job. We're just like an emergency room on wheels. And we deal with a lot of different medications, different procedures that we have to learn. And we have to keep recertifying every year. So it's not like you learn it once and then that's it. No, I mean, in my career, I must have gone to about every 2 years, 10 classes, so maybe, I don't know. It's amazing how much continuing medical education we have to do.
And Doctor, you started your career as an EMT, am I right? That you've done this kind of work also out on the road. Tell us about that.
I did. When I started as an EMT, we learned skills, and I worked for about 3 years, and I realized how hard it is for these folks to do it, both mentally and emotionally, but also physically. The patients that they have to extricate out of houses, out of buildings, it's something that they have to be on their top game every single moment. You know, I'd really like to say to these folks in EMS and people considering a career, it's one of those things that when you go home at night or when you look at yourself in the morning, you can actually be proud that you're doing a good thing for other people, and it's because you want to. And you can really tell those EMS folks when they come into the hospital that they have a lot of compassion and professionalism for their patients. Chief Nakano was talking about the advances and the things that they have to learn to keep up. Just as many new protocols or treatments that we have in the hospital, it extends out to the field, so these folks got to keep on their game and always be open to learning. It's not something that you can just get a job and sit out back, but it's something you can really be a professional at.
Mm-hmm. You know, you have a lot of people who are coming up. You've done it for 20 years. What's kept you in that job? What's kept you coming back?
I get to help people every day, you know, and sometimes they're in dire need, and you get there and you can help them, and if you do everything right, they get a chance to walk out of the hospital, you know, with everything intact and live a normal life. You know, sometimes you bring somebody back from the dead, they get another Christmas, they get another day with their family, you know, and that's why I do it, because, you know, help as many people as I can before I'm done.
I mean, when you put it that way, giving someone another Christmas, what a gift.
Yeah.
That's incredible.
Yeah.
Della, this question comes in from Beverly. How do we get more ambulance coverage for the area between Kaneohe and the North Shore? How can the community work to support this? What would you say to folks, not necessarily just on the North Shore, but throughout this island, who hear these numbers and feel some alarm?
So the requests that have come in have been for the urban core, but I think what's important to remember is that the more that we can bring into the urban core will actually alleviate, and it's kind of a domino effect, right? Because these ambulances, these units cover the entire island. As we heard, the windward side is coming over to town side. The more that we can even just get, if we can even just get one additional unit, that'll help alleviate the stress on all the other side.
New York City has a system that uses 911 or 311 depending on non-life-threatening or life-threatening scenarios. Could we adopt a similar protocol? What is the protocol for that right now?
Well, you have to understand that New York City has 8 million people, and their fire department has 696 ambulances.
Well,
So-
by that ratio, we should certainly have many, many more because we're
Correct.
dealing with over 1 million.
Right. That's, if you do the numbers, we should be have about 60 ambulances on this island. But so what they do, they have like 250 advanced life support ambulances, and the rest are BLS ambulances. So those BLS ambulances can take care of the really non-emergent calls, and they cover take care of their 8 million people. That's what I would like to do. I would like to institute more BLS ambulances so we can, give these guys in town a break.
So basically a tiered system.
Correct.
How likely is that to happen?
Well, it's sort of like Representative said, it's all about the money.
Show me the money.
What happens when a patient does not have insurance? How does the city collect? When you respond to a call, that's not the first question you're asking.
We don't usually triage by insurance, no, no. So if you don't have insurance, we'll still help you. We'll still bring you to the hospital. We'll do whatever we need to get whatever you need. As far as the insurance part, our department deals with that. So we have a finance department that deals with that, and they'll deal with that later. But for the most part, we take care of the immediate threat, the immediate medical issues, and then so we don't have to deal with the insurance. I'll usually ask, what type of insurance you have. If you have an insurance card, I'll write the numbers down. That way we can bill your insurance. But if you don't have insurance, that's not my first priority. My first priority is your health.
I think there is a perception that if you call 911, you'll get into the ER faster. You'll get that care faster. It somehow,
Not necessarily.
shoehorns you in, if you will.
Yeah.
What would you say to people who may have a situation where they actually could drive, but they're on the fence?
Yeah, if they want to go to the hospital with us, we'll take them. We won't tell them no. It's my job to take you to the hospital and get you care. But we will try and educate you on what you should be calling for. And if it's something if I'm taking you to the hospital for something that's really not emergent, I'll try and educate them like, hey, next time you have this problem, maybe you should try and find an alternate means of transportation. However, I will never tell them not to call 911 just because, if they really feel they need us, because if they need us, we're going to come, As far as triaging when they get to the ER, when we get to the ER, it's a whole nother ballgame because we got to talk to the triage nurse, and then they decide how quickly you get into the emergency room, Patients who are really sick, we give the ER a heads up. We call in to let them know that we're coming in over the radio, and you may get seen quicker depending on what's wrong with you. But as far as once we get into the emergency room and past the doors, I'm going to pass that on to Dr. Kuroda over here.
Right, and so that perception that somehow you get to jump the line, because there is a feeling that, if I go to the ER, I'm going to be sitting in the waiting room for however many hours. Maybe if I call 911, I get to jump ahead.
Sure, I hear that all the time. Patients do think that, but we do have a similar system that they do where we'll take a look at the patients, see what kind of issues they have, what kind of complaints or pains, what kind of symptoms, and their vital signs. So you might have somebody coming in on a stretcher in front of somebody else, but that person will go to the waiting room to be gone through our quick process versus another person who would go straight to a major resuscitation room just because of whatever their complaint is, say a stroke.
This sort of piggybacks on that idea. I've overheard nurses and EMTs discussing so-called frequent flyers, people who call 911 regularly to come to the ER to have bandages changed, wounds cleaned, etc. Do EMTs have any discretion in who is picked up? Could community health vans be dispatched via 911 as a viable option? Hannah S. is writing in on that. What about this idea of so-called frequent flyers?
We have frequent flyers. There's no doubt about it. But like Tony said, when they call 911, most of the time they actually are sick and need to be seen because they are sick because there's nobody else to take care of them. But we do get occasional calls of people needing their medications refilled, needing their bandages changed, and we'll take care of those people, but we won't necessarily just transport them to the hospital to get their medications filled.
But you still might need to go out and send a paramedic to the scene to help assess. I mean, that definitely clogs the system. What would you say to people, you know, to those frequent flyers? I know you don't want to discourage anyone from getting care. We get that. But what kind of a burden is this placing on the system?
Well, I have some numbers for you, but we have about 200 to 300 frequent flyers. And some of them, we have one person who's called the ambulance 78 times and been transported 78 times in the last 4 months. But he's sick, and you know, he needs to be transported. But then you got other people that just use us for a taxi service.
How much is that taxi ride?
$1,250.
And who's paying for that?
If you don't have for insurance, see, the part about the insurance is now the insurance companies are getting a little more strict. If they determine that you used the ambulance and it was not a true emergency, you would have to pay for that. And then we don't do the billing like Tony said. It's all the state. State does all the, because we are funded by the state. They take care of the billing. So they have their own billing company. They take care of the bills.
Yanji, I can comment on that. So on an annual basis, about $36 million comes in from billing to the state, and it comes back and is returned to the general fund. But let me go back to the number that I started with originally. We appropriate $87 million. So insurance doesn't cover all of the cost. Clearly, the state is subsidizing a huge amount of it. We have to do a better job of making sure people have insurance, and that's why the Affordable Care Act is so important. We have to make sure that Medicaid is strong. We have to utilize our Medicaid services and try to understand if there are frequent flyers on the Medicaid, how we can get better primary care services out to those folks. So again, it's a system that we have to look at and find the levers to push to make sure that people are getting the appropriate care at the appropriate time, and as much as possible, try to do the preventative care. But it's a complex system.
Now, you brought up earlier in the program this idea of those mobile units, and I know that that was something that was on the table. Why did that not go through?
Well, we know that there's homeless outreach services that do similar things, maybe not at the level of a doctor and a nurse, but when we looked at that proposal of a mobile clinic, the resources were not making sense to be used in that way. We do, again, have homeless providers that had Medicare vans or care vans. They have since, some of them have since shut down those programs. Those would have been the more appropriate things to fund. So we did put money into the budget for homeless outreach services. And that's the kind of thing, that's the kind of balancing that we're doing. You know, it's great to say, let's create a program, but if it's not going to be sustainable, you know, that's not something we should invest in. We should invest in those things that we know can draw down Medicaid funds, can draw down insurance, private billing. We have to find those resources and be very strategic about the programs that we create.
What do you think is the best way for people who are watching at home tonight, if this is a priority for them? How should they let their lawmakers know? Is this something that they lobby the city on? Is this something that they call, you know, your committee on? What is the best way to actually get involved on this issue?
I think it's about lobbying your state lawmakers, but, you know, again, the county can step up as well. So if, you know, when the county comes in and wants to do a BLS unit instead of the full paramedic unit, encouraging that kind of conversation to happen at the county level, looking at ways to maybe use the TAT to help supplement this if it's not already being used. The other way that the public can get involved, though, is just by also leading a more healthy lifestyle, because the healthier we all are in the long term, the less strain is on these guys, right? And it just makes sense, you know, getting your regular primary care doctor checkups, which are now available for us under ACA, the Affordable Care Act, for now. You know, doing those kinds of things will help alleviate the system. And, you know, I like to listen to Commissioner Ito, our insurance commissioner. You know, he always talks about we all just need to get healthier. We all just need to be a part of making sure that our system is strong, and part of that is taking personal responsibility.
I mean, Dr. Della has a good point, not waiting until it is an emergency.
That's a terrific point, and I really wish that we had a lot better health education or health literacy, especially as we're growing up, because if we can reach the younger people earlier, talk about diabetes prevention. We actually have an outreach program with Waipahu High School to try to keep people healthier longer. It would definitely benefit from when they're in their 20s or 30s, because now we're seeing younger people coming down with heart disease. Sometimes we're seeing some cancers, and these are new things in that age generation. If I can get back to the thing about what we would call frequent flyers, sometimes we have homeless, but we also have the older, frail people that are coming in. If you're getting into your 80s, and one of the great things about Hawaii is that everybody's living longer, but at 88 years old, something will end up happening to you if you have a stroke, or if the person who you are married with and have been married to for 60 years get ill. Somebody's going to be taking care of the other, and there's going to be a strain on the family. And that is one of the things that EMS does function, helping those folks come in, because I've heard stories of the wife is 86 years old and she doesn't drive at night. So it's not necessarily a viable option. The patients that use the system a lot and come in very frequently, we have a great young doctor, Danny Cheng, who's actually trying to work on programs like that, or to see what's a good solution to help people who either are homeless and do have true medical illness, because they're vulnerable. Who else does help them? We kind of need to provide that for them.
This question comes in for the chief from Mike and Mililani, asking, is the current lack of resources putting us in a crisis situation now? How does the city, county, and state prepare to handle this?
Well, I don't, it's not a crisis right now, because we got great people working and we're managing. It's just gonna, how long can we manage like this? If the state doesn't give us more money to open a few more stations to lessen the call volume for our guys.
And what about the growing tourist population? How do they play into all of this? We're anticipating 9 million in the next year to come. I mean, obviously not all at the same time, but those are folks that aren't necessarily counted in the same way, but they call 911 just the same.
Right. You'll see Tony from Kailua and Waikiki Beach a lot more.
Right. How many of the calls that you get are for tourists, for visitors?
Well, now that I'm in Kailua, not as much. But while I was in town up until last January, I don't know, maybe 10%, 15%, maybe. Yeah.
Well, I mean, that's a good chunk of your call volume.
Yeah, because you got your old people that come here, and even young people, but guys come here and they're active and they get hurt or they get sick. And they're away from home. They have nobody to call, so they call us. Yeah.
And that's where the TAT could come in.
Certainly.
If I could add to that, we have a hospital on the west side of the island with the Aulani and the Four Seasons. And some of our frequent calls are the kids that are at the pool running around, fall down and strike their head and end up with concussions. I know that I see the Nanakuli unit at least once a day going out to Aulani and bringing in a tourist from somewhere in the mainland or from a foreign country. And with the growth and investment from the Chinese, that's a bigger population that's going to be put out there, as well as the local housing market out there in Eva. So it's something that we're thinking about as well.
This is a question. How much do paramedics make, and do you believe they should be paid more? Joey from Kalihi. Well, I think that if you said that they didn't deserve that, you'd be in a lot of trouble. But just to give folks an idea, what is the salary that you're looking at for someone who does want to join your ranks?
An entry-level paramedic makes around $60,000, but they can supplement that by working overtime, which is abundant for us, and an entry-level EMT can make $47,000.
And just so people understand how that works, you enter as an EMT. Tell us about the process.
We get the EMTs are schooled at KCC. They have to go to 400 hours. Then they apply for the city job. They get hired, and they're required to work for us for 2 years and run about 200 calls. And then they're eligible to apply for paramedic school, which we pay for, which is a great deal. And they go through a rigorous 1 year, 1,250-hour course. And I'd say every year we have maybe 10 to 15 applicants, and usually we get about 8 to 10 of them graduate.
Because this is not an easy job.
Correct.
Talk about that, about the EMTs making it to becoming paramedics and then keeping them as paramedics. That's a
Right.
pretty tough road.
It's a tough road, but it's a rewarding road, you know. And a lot of people get into this job because they want to help people, and you know, but when you actually start doing it, that's when you realize what the job entails, and it's not an easy job. You know, you get out there, you got to be physically able to do it, mentally able to do it. You got to be able to retain the knowledge that you learn when you're in school, and you have to do that throughout your EMT, when you start working as an EMT, and then through paramedic school, and then you got to go through an evaluation process. So the attrition rate is kind of high, and so that's why we're having such a tough time keeping, you know, our paramedic level high, because we lose a lot of guys along the way. Yeah, because it's not an easy road. It takes 3.5, sometimes almost 4 years.
And if you're doing 15 calls a day on a 12-hour shift,
Yeah.
that's tough.
Yeah.
Yanji, can I make a pitch? So I know that we have public high schools that have healthcare career tracks. I also know that there are private schools like Marino School that I think has like a healthcare track as well. And I just want to make a pitch to those middle schoolers and high schoolers out there. If this sounds like something for you, that you want to help, that this is a good job. $60,000 as an entry level is a decent salary. So, you know, we got to start pitching now to those younger students.
This is an interesting funding question, and the doctor brought up those communities that are coming up, you know, out by Aulani. When new communities are built, is funding directed toward parks, libraries, and schools? Why is funding directed toward park, libraries, and schools, but not emergency support? Can't developers be required to provide funding for EMS when proposing new housing?
That is a great idea. So we have school impact fees that do extract some of that. There's a lot of controversy around that, but certainly we should be looking at community benefits from developers, particularly if they're going to be benefiting by growing out these large communities like Ho'opili or along the rail line. You know, we need to have all sectors of our community contribute, including our development community.
How do we get that conversation going?
We can start it now. And you know what? Community benefit development funds are tools that we can use.
You know, I think that people think of a school or they think of a park. They don't necessarily think like, oh yeah, I might need to call 911 at some point. Chief, I'm sure you can speak to that.
Well, like I said, we ask for an ambulance station every year, and the last one we got was Ever Beach, and that was 5 years ago. And the only reason we got that one was because Hawaii Medical Center West had closed and there was no hospital there. So that was an emergency appropriation, and that's how we got our last ambulance.
Given how fast our population is growing and the number of visitors, that influx, at this level, how long can you sustain it? I mean, I know there is no choice, right?
Yeah.
But when do we get to a crisis situation? Is there a population number?
I can't answer that question. If we are at the breaking point, we're close. Once in a while we have to close a unit because we don't have enough staff. But the other units step up, cover the area, and that's why I said we have great people working for us.
Yeah, we all need to thank all of them.
Yeah.
This question comes from George in Wahiawa, who says, we used to have an air evacuation helicopter from the Army. Could we use that for critical cases in remote areas? Can we ask the military to help us out?
They helped us out for a while, and then there was they were all deployed, so they stopped. Now they returned, but it's become an issue that when we used them before, the time it took to drive the patient to the hospital versus getting the helicopter there and loading the patient in the helicopter, flying the patient to the hospital, unloading the patient, going down to the emergency room, the drive time was almost the same.
Speaking of drive time,
Can I add to that?
Please.
I've beat the helicopter before. So, yeah, so it does, just because it's a helicopter on this island, it doesn't necessarily mean it would get you there faster. Because like you said, between the time to ramp up the helicopter, get it to the scene, you got to drive to where the helicopter can land usually, fly them out. If I just load and go, I've beaten a helicopter before.
Wow, and speaking of traffic, I definitely want to hit that point. I know we're getting close to the end of the hour, but you had a campaign a couple years ago about trying to get people to get to the side. How important is that? I mean, if you're handling 15 calls, obviously, if you see those sirens going, get out of the way.
Do it safely. Get out of the way, but do it safely. Yes, pull over to the side. Don't do anything rash, like slam on your brakes. But yes, if you can get out of the way, it'll help us get to these calls a lot quicker. Yeah. And get to the hospital a lot quicker.
There was a question here for Della, and that is, what will be done for EMS over the next year from the legislature's perspective? The session is now over, but of course, we're always thinking of what's next.
So all of those requests are still there. It's a 2-year biennium, and every year EMS can come in again and make the case. I will say though that because it's a statewide system, amongst EMS statewide, Kauai and Big Island are kind of like in line, and so they would be first. And it really, the case has to be made, I think. We need to identify more revenues, and part of the revenues are going down, right? So part of the funds comes from the cigarette tax, which we've done such a great job public health-wise that amount is diminishing. So we need to, become more creative and identify some other sources.
I mean, Chief, how frustrating is that? She says that the case needs to be made. Clearly, the four of you have made the case.
It's very frustrating. It's very frustrating. But we every year we put in our requests, and that's the best we can do for now.
What can the public do? What would you like to see?
I would see more pressure.
We're feeling it.
But it's something that it's not in our control, actually. Like we made our proposal, and like she said, the Big Island and Kauai went ahead of us. Mm-hmm. And they didn't get it funded either.
They also did not get funded.
They didn't get. We were supposed to get our ambulance next year. So I don't know what's going to happen since Kauai and Big Island didn't get their ambulance this year.
And that would be for the Salt Lake area? Where was that supposed to go?
The state designated Salt Lake as the next ambulance station.
Tony, on a practical level, we're coming near the end of the hour, but what do you want people to know about what you do and what they can do to support your services?
What do we do? Boy, that's such a broad question. We're there for you if you need us. You call 911 if you need us, and jeez, it's so broad. I don't even know where to start.
Well, we know you're there for us in our time of need. What do you want the public to do to help to support those folks out there?
Thank them when they come, which I'm sure they do. Talk to your legislature. Tell them we need more ambulances, because we're near the breaking point. And we're at the point where, we almost can't handle the amount of calls that are coming in because we're stacking the calls. We can respond to these calls, but sometimes you might have to wait a little bit. So, and that's not good for anybody, and we don't want you to wait if you don't have to, especially if you're really sick,
Doctor, you talked about taking care of your own health. What else do you think the public can do to support EMS?
Well, one of the things that Tony won't say about himself is these guys are heroes. The jobs that they do, they save lives, and they make the lives of the patients' families better. As far as supporting EMS, Representative Bellotti had a great idea, is that if people take care of themselves better, talk to their primary care doctors, make their scheduled appointments, it would help out, especially if they maintain their medications. A lot of times, if they're less sick, it's easier to get somebody out of the house or package them up, because sometimes it's going to take 2 or 3 folks just to try to help lift somebody up out of the bed who's 400, 500 pounds, so that they can transport them out. And that eats up time on a call. If I were to ask something general, just improve their health literacy, talking to their doctors. What can I do to make my health better? And don't be afraid to call 911 if you're worried, because these guys are good.
Chief, we have just 30 seconds left. Any parting thoughts tonight?
No, I'm just glad that people need to realize that we are overtaxed, and like Tony said, be patient. You call 911, we'll come, we'll be there, as soon as we can, and we're there to help. We're not there to antagonize anybody. We're there to help people.
Well, it's tremendous work, and we thank you all for being here tonight. And mahalo to all of you for joining us as well. We want to thank our guest, Dean Nakano, EMS Chief for the City and County of Honolulu, Dr. Roland Kuroda, Emergency Medicine Doctor, Tony Altomare, Paramedic Supervisor for Kailua Unit of EMS, and State House Representative Della Albalati, the newly appointed Vice Speaker of the House. Next week on Insights, the National Institutes of Health spends over $6 billion a year on cancer research, over $4 billion a year on heart disease research, and $3 billion on HIV/AIDS research. But only $480 million is spent on Alzheimer's research. Find out why healthcare professionals and the medical community fear that Alzheimer's disease could bankrupt our healthcare system. Join the Insights discussion right here on PBS Hawaii. I'm Yanji Denise for Insights on PBS Hawaii, and until next time, ahui ho.